Good morning. This is Dr. Kusuma again from Suria Cosmetic Surgery. It's Thursday morning, consult day, as we have been meeting like this. Um, so today I met some people of a younger age category for facial rejuvenation. Okay, so a typical question that comes up frequently is what is the best age to do actual surgery? Not the non-surgical things like Botox and fillers and non-surgical skin tightening like Renuvion J plasma or other such things, strings, threads. But what is a good age to actually do surgery? Well, I can tell you that as a facial rejuvenation focused surgeon, the single most effective procedure for facial rejuvenation is what is the lower face neck lift surgery, lateral brow elevation, eyelid surgery. They are extraordinarily effective. The biggest fear people have is they're not going to look natural. The biggest fear they have is risk of anesthesia. The biggest risk or biggest fear maybe they have is pain and downtime associated with it, or their expressions are going to change, or is it too early for surgery, etc. Again, I in my practice I try to emphasize that when done correctly, when done thoroughly, when done with good understanding of tissue relationships, tissue positions, and proper techniques are used, you could do an extraordinarily effective surgery for any age category, really, for that matter. What is that age category actually? So in my practice, I've done facelift surgery on patients as young as 30s and as old as 90s, in mid 90s. I mean, that's a pretty broad range. The most valuable, the most value based, effective, immediate correction is surgery at the end of the day. With so many providers and physicians now doing all these non surgical things, there's definitely a place for them. But if you want the best bang for the buck, and if you can diagnose the changes that you want to correct properly, surgery may be the best bang for the buck you could ever get. Adjuncted or augmented with the other non-surgical after the surgery, so that you don't have to do less of it, less frequently, and maybe never, hopefully, right? So that's what my general recommendation is, to start. And it's almost always like fashion. It always almost seems like you go back in circles and cycles in life. Bell bottoms used to be popular back in the day, they went away, and now they're popular again. Ray-Bans used to be popular back in the day, they went away and they're coming back again, right? So in surgery also, we're kind of making a full circle. It almost seems like, back when facelift surgery first started, people used to do it in their late 40s, early 50s, and then do it again in their mid 60s, and do it again, later if they're healthy and doing well. And now it almost seems like there's certainly a segment of population that's going back to that, and they want to look the best. It's almost like the motto, maximize today, right? No reason to wait. Maximize today and be the best version of yourself today and every day. And so if that's the case, then why wait if you can do it? And if you're healthy, because 5 years from now nobody knows what's going to happen. So my motto generally has been maximize today, be the best version today. So if you take that into account, if you feel comfortable with a surgeon who's going to be straightforward and recommend the best solution for you, and if that's surgery, no matter what age, you should take advantage of it. So the age could be from the 30s, early 40s, late 40s, 50s, all the way to the mid 90s if you're healthy. And as a matter of fact, I made a promise to a patient of mine, which is going to be an epic day, because she's 98 years old as of last week, and we celebrated her birthday because she's like my grandmother. And I love her, and we have a very special relationship because she's one of the most positive, most inspiring people that I know in my life. And she has a special place for me. And she makes me promise every month when I meet her that the good Dr. K, when I hit 100 in 2 years, we're going to do my facelift surgery again. And I promised her, I said, if you do reach 100 and you're healthy, we will do that. And as a matter of fact, I'll broadcast it live on national TV, to the whole world for that matter. Because now we don't need TV, we have Instagram Live, we have Facebook Live, right? So, all kidding aside, I was serious with her. But so the age of proper surgery is any age when you feel ready, if you want to get the best value, because these surgeries are the most effective procedures you can do to significantly change the look of something and restore something very naturally, very safely, and very comfortably. Thank you.